Hi, everybody in the Heart Heal Circle. Joel Kahn, cardiologist, between patients here at my Kahn Center in Bingham Farms, Michigan. Well, we have 4 questions that have come in that I do want to answer in a way that everybody learns a little bit. I can't answer a specific medical issue for you because we have to have a doctor-patient relationship in my clinic, but I can still answer general questions. So the first question came up with somebody that has a very common heart condition that I take care of called atrial fibrillation. It can cause no symptoms. It can cause beating and racing. It can cause dizziness. It's more common as you get older and high blood pressure, if you drink a few too many highballs and such, thyroid conditions. But the question came up, I have atrial fibrillation, and at nighttime I still feel some skipping. What should I do about it? Well, my answer that I want to take care of here is there's been a real breakthrough on devices you can have at home where you can actually monitor your heart rate if you're having a problem like this. Not everybody needs these. One, you can get the Apple 5 watch, and as you may know from headlines, Apple 5 watch will alert a person who's wearing one if the watch detects they've gone into atrial fibrillation, whether they're having symptoms of heart racing or not. It's not 100% perfect, but it's the first time a wearable watch has been able to do that, built on internal algorithms and detection. It'll get better and better. But I have a lot of patients have an Apple 5 watch just for detecting atrial fibrillation. Plus, if you put your fingers on the watch, you can actually see your EKG. So it's 3 in the morning and you want to know what the heck's going on, you can actually do that. The second device, which isn't as complex as getting the whole Apple 5 watch, is a device I have no financial ties to. It's called the Kardia, K-A-R-D-I-A Alivecor. You can go to Amazon and put in Kardia. You will see this device. It costs about $80 to buy this piece of plastic with the 2 silver tabs. But there's also an app that you download to your smartphone. And when you have that all set up, you put your fingers on the silver tabs, it will actually show you your electrocardiogram, like you're in an emergency room or urgent care center or my cardiology clinic. And you can do that for 30 seconds, you can save it, and you can send it to your cardiologist. If you're my patient, you can send it to me, as hundreds of patients have. And for a cost of under $100, this has been a breakthrough in the last 2 to 3 years. Then when you know what's going on, what is the rhythm, what are the skips, what is the nature of the problem, then you can design a plan. But until you make a diagnosis, now of course, you can just go back to your doctor and wear a 24-hour, a 48-hour, a 1-week, or even a 4-week heart monitor so that you capture them in the more traditional way. Second question, I have a leaky aortic valve. Your heart valve up here, it's leaking. How do I know, and how quickly is it going to require surgery? Well, the majority of people with aortic leaking, called aortic regurgitation, or also called aortic insufficiency, never need heart surgery. It's only those with the most severe form who also develop shortness of breath or heart enlargement. The bottom line is, if you know you have that condition, you follow with a cardiologist. If it's minor or moderate, which is very common, maybe once every year or 2 you have an ultrasound, somebody listens to you with a stethoscope, you watch for shortness of breath, weakness, and inability to perform your day-to-day activities. If you have a more severe form, you just get watched closer. And cardiologists do have, we call them guidelines, suggested rules of when surgery may be needed. But for the majority, it's never. You want to make sure your blood pressure is good, and there are medications for your blood pressure that may delay the progression, so you never need surgery also. Third question is high blood pressure. What are the issues from high blood pressure? Well, high blood pressure is the #1 cause of death in the world, so we have to pay attention to it. High blood pressure sustained can lead to clogging arteries causing heart attack, clogging arteries causing stroke, clogging arteries to the legs, peripheral vascular disease, or PAD, clogging arteries even to the kidneys. It can also cause direct kidney damage, even if it doesn't affect the arteries per se. It can also cause the heart to get thicker and lead to a condition you know of called congestive heart failure. Finally, occasionally the blood pressure rises so dramatically it can injure the aorta and be involved with a very severe process, even life-threatening, called aortic dissection. How do you know you have high blood pressure? Well, you can't tell it from the Kardia device. You need a home blood pressure cuff, and you need to check your blood pressure at medical visits. Some dental offices have blood pressure cuffs, but you should have a home blood pressure cuff yourself. And the last question that came up is the proper way to measure blood pressure. And this is important because anything poorly done is not going to be of as much value as something properly done. And you should have a digital blood pressure cuff that fits on your arm, not on your finger, not necessarily on your wrist. You should sit with your arm on the edge of the sofa, kind of about the level of your heart. I like when you just have to put a Velcro cuff of the right size. If you weigh 350 pounds, it's not going to be the same cuff as if you weigh 150 pounds. And it should fit comfortably. And you should do your blood pressure 3 times with about 30 seconds in between. Let it do it. Look at the number if it shows you. Wait 30 seconds, relax, do it again. Wait 30 seconds, do it again. Some people actually like to have their little pet doggy next to them and rub their dog. It actually lowers your blood pressure. Listen to Mozart music. It lowers your blood pressure. No joke about that. It doesn't matter what time of day you do it, because you don't want an elevated blood pressure in the morning, afternoon, or evening. Now, it does turn out that the most accurate blood pressure is actually the blood pressure response while you're asleep. Normally should go down a little bit, called dipping. Well, you're not going to wake up and check your blood pressure because you're not going to be asleep then. So there is something called a 24-hour ambulatory blood pressure monitor. We use that a lot here in my center. You may have a little difficulty finding one around your town, but it is well worth it if you can. Do you have white coat hypertension or not? Well, just wear one. We had a classic yesterday. Gentleman returned it and said, I hated that cuff. Every 15 minutes it was causing anxiety. I know my blood pressure was 200. In reality, his blood pressure was 130/70 during the day, 120/80 at night. You couldn't have a more perfect response. It was very reassuring. So there you go, 4 questions, 4 answers. I got to get back to patient care. You have a heart healthy day, and thank you for being a member of this Heart Heal Circle.